Have you ever wondered what orchestrates some of your body's most critical functions? From the strength of your skeleton to the resilience of your immune system, a powerful conductor is at work behind the scenes. This conductor is not a complex organ, but a simple yet profoundly important fat-soluble corticosteroid hormone, often called vitamin D3. It is a small molecule with a massive impact, acting as a master key that unlocks genetic switches throughout your body. Understanding its role is not just an academic exercise. It is a fundamental step toward taking proactive control over your long-term health and well-being, influencing everything from how you feel today to how well you age tomorrow. Vitamin D3, scientifically known as cholecalciferol, is a unique nutrient. It is one of the few vitamins our bodies can produce endogenously, meaning from within. This remarkable process is initiated when our skin is exposed to a specific wavelength of sunlight, ultraviolet B radiation. The energy from the sun converts a cholesterol precursor in our skin into pre-vitamin D3, which then isomerizes into D3. We can also obtain it from our diet through a limited number of food sources, and very commonly, through supplementation. It is distinct from its plant-based counterpart, vitamin D2, as D3 is the form that is more efficiently converted and utilized by the human body for its countless biological functions. When doctors measure your vitamin D status, they are typically looking for a metabolite called 25-hydroxyvitamin D, or 25-OHD, in your blood. This is the main storage form of vitamin D, and its level provides a clear picture of whether your body has a sufficient reserve to draw upon. This single blood test can reveal a great deal about your potential risk for a host of health issues. Maintaining an optimal level is critical because D3 doesn't just perform one job. It is a pleiotropic hormone that influences the expression of over 1,000 genes, making its sufficiency a cornerstone of preventative health and a non-negotiable component of a robust internal environment. This essay serves as a foundational guide to this essential nutrient. We will explore what happens when our levels fall short, detailing the subtle and overt signs of deficiency that many people unknowingly experience. A deficiency in vitamin D3 often speaks in whispers before it shouts. The initial symptoms can be incredibly subtle and are frequently dismissed as the normal consequences of a busy or stressful life. One of the most pervasive signs is a persistent, non-specific fatigue or a general feeling of being unwell. This is not the ordinary tiredness you feel after a poor night's sleep. It is a deeper, more chronic exhaustion that seems to linger day after day. You might find that your physical performance suffers, or that activities that were once easy now require significantly more effort. This deep-seated weariness can be a direct result of inadequate D3 levels, impacting cellular function and energy metabolism. Another common yet often overlooked indicator is chronic musculoskeletal pain. This can manifest as a dull, aching sensation in your bones, particularly in the lower back, pelvis, hips, legs. Some individuals describe it as a deep, throbbing ache that is difficult to pinpoint. This discomfort arises because vitamin D deficiency can lead to a defect in the mineralization process of the bone matrix, a condition known as osteomalacia in adults. This defective mineralization can cause hypersensitivity in the nerve endings within the bone's outer membrane, the periosteum, leading to a persistent and frustrating experience of pain and tenderness that does not resolve with simple rest. The most well-established and understood function of vitamin D3 is its indispensable role as the primary regulator of calcium and phosphorus homeostasis in the body. Think of D3 as the essential gatekeeper that controls how much calcium your body can actually absorb from the food you consume. When you ingest calcium-rich foods, dairy products, fortified plant milks, leafy green vegetables, that calcium enters your small intestine. However, without sufficient vitamin D3, the vast majority will pass through and be excreted as waste, never reaching the bloodstream. The mechanism is elegant and precise. Vitamin D3, after being converted to its active hormonal form, calcitriol, travels to the cells lining the intestine and binds to the vitamin D receptor inside these cells. This binding sends a signal to the nucleus, turning on genes that produce calcium-binding proteins like calbindin. Calbindin and similar proteins shuttle calcium across the cell membrane into circulation. Adequate D3 is the absolute requirement for efficient calcium absorption. This process is critical for bone health across your life. The skeleton is a dynamic tissue, constantly remodeled. Building new bone requires a steady calcium supply from blood. When D3 keeps blood calcium adequate, osteoblasts can deposit it into bone matrix. That continuous supply gives bones density and strength, reducing fracture risk. Without enough D3, the body faces a calcium shortage. It triggers a backup. The parathyroid glands release parathyroid hormone. That hormone tells bone to release stored calcium into the bloodstream. Short-term, this stabilizes blood calcium, but long-term it causes progressive bone loss. Demineralization makes bones weaker and porous, leading to osteomalacia and ultimately osteoporosis. Beyond its classic role in bone metabolism, vitamin D3 acts as a powerful and sophisticated modulator of the immune system. Its influence is twofold. It strengthens our innate immunity while also regulating our adaptive immunity. Key immune cells, including T cells, B cells, and antigen-presenting cells like macrophages, are all equipped with vitamin D receptors. The presence of these receptors signifies that D3 can directly influence these cells, acting as a master switch for immune readiness. When it comes to innate immunity, vitamin D3 is crucial for arming our frontline defenders. Upon detecting a pathogen, such as a virus or bacterium, immune cells increase expression of the vitamin D receptor and activating enzymes locally. That locally activated D3 triggers production of antimicrobial peptides, such as cathelicidin and defensins. These act like natural antibiotics, disrupting pathogen cell membranes and killing them. This is especially important in the respiratory tract, helping protect the lungs from colds and the flu. Simultaneously, vitamin D3 tames the adaptive immune response. It promotes tolerance by modulating T cell activity. Specifically, it can dampen pro-inflammatory T helper cells like Th1 and Th17, while promoting regulatory T cells, TREGs. TREGs are the immune system's peacekeepers, suppressing excessive inflammation and preventing attacks on the body's own tissues. That self-attack is the hallmark of autoimmune diseases like multiple sclerosis and rheumatoid arthritis. This dual action, enhancing initial defense while preventing overreaction, makes vitamin D3 vital for a balanced immune system. Studies link low vitamin D with higher risk of acute respiratory infections and autoimmune conditions. Maintaining optimal D3 is a long-term strategy for a resilient, well-regulated immune environment that can protect you from a wide spectrum of health challenges. The influence of vitamin D3 extends deep into the central nervous system. It plays a significant, though not fully elucidated, role in brain health and mood regulation. The brain is replete with vitamin D receptors: prefrontal cortex, hippocampus, substantia nigra. These regions are involved in planning memory formation and regulation of emotion and behavior. The presence of receptors implies D3 has a direct biological function in neural circuits. It influences production of key neurotransmitters, the chemical messengers of brain communication. One compelling link is between D3 and serotonin, the feel-good neurotransmitter for mood balance. Active D3 can activate the gene for tryptophan hydroxylase 2. That enzyme is essential for synthesizing serotonin in the brain. Low D3 can impair this process, potentially lowering serotonin and contributing to depressed mood. This may explain seasonal mood changes, lower in dark winter months, better in bright summer. Vitamin D3 also has neuroprotective properties. It helps protect brain cells from oxidative stress and from inflammation. Both processes are implicated in neurodegenerative diseases and in psychiatric disorders like depression. D3 upregulates antioxidants like glutathione and reduces inflammatory signals, helping maintain a resilient neural environment. This protection supports mood and helps preserve cognitive function as we age, potentially reducing risk of age-related cognitive decline and dementia. Supplementation is not a standalone cure for clinical depression or other mental health conditions, but evidence shows it can be a useful adjunctive therapy, especially if you have a confirmed deficiency. Clinical trials show correcting low D3 can improve depression symptoms. Fortunately, addressing low vitamin D3 levels is often straightforward and can be achieved through sensible lifestyle practices and, when necessary, supplementation. The most natural and primary source is sensible sun exposure. Our skin is a remarkable factory for D3 synthesis. Expose large surface areas of skin to direct midday sunlight for short periods. Arms, legs, midday sunlight. Ideal duration varies based on skin tone, latitude, season, time of day. For fair skin, 10 to 20 minutes a few times weekly in summer may suffice. Darker skin may require longer. The key is to never let your skin burn. Sunlight year-round is impractical for many, especially in northern latitudes, so dietary sources matter. Very few foods are naturally rich in D3. Salmon, mackerel, herring, sardines. A single serving of wild-caught salmon can provide a significant portion of your daily needs. Beef liver, cheese, egg yolks. The D3 is in the yolk, not the white. Fortified staples, milk, plant-based milks, orange juice, breakfast cereals. Collage of D3-rich and fortified foods. For most people with limited sun and little fatty fish, supplementation is the most reliable way to reach optimal D3. Supplements are widely available, inexpensive, and safe when used appropriately. D3, cholecalciferol, is preferred over D2, ergocalciferol, as it raises and sustains 25-OHD better. Common adult doses, 1,000 to 4,000 IU daily. But the ideal amount depends on your starting level body weight and other individual factors. Take D3 with a meal containing fat to enhance absorption. Confirm your status with a blood test for 25-hydroxyvitamin D, 25-OHD. Discuss testing with your healthcare provider, especially if you're high risk. Older adults are at higher risk for vitamin D deficiency. People with darker skin are at higher risk for vitamin D deficiency. People with obesity often have lower circulating vitamin D levels. People with minimal sun exposure are at increased risk of deficiency. Individuals with medical conditions that affect fat absorption can have reduced vitamin D uptake. Testing removes guesswork and lets you tailor supplementation to be effective and safe for your unique physiology. While the information presented here provides a strong foundation for understanding vitamin D3, it is crucial to approach your personal health with a collaborative mindset. You should consider consulting a healthcare professional if you experience persistent symptoms associated with deficiency, chronic fatigue, widespread muscle or bone pain, frequent illnesses, significant mood changes. These symptoms are nonspecific and can indicate other underlying health issues, so a proper medical evaluation is essential. A doctor can assess your complete clinical picture and determine if a vitamin D test is warranted. Seek medical guidance before starting any high-dose supplementation regimen. Vitamin D is generally very safe, but it's fat-soluble, so excess can accumulate over time. Prolonged, very high doses without supervision can cause vitamin D toxicity, hypercalcemia, or dangerously high blood calcium. This can cause nausea, weakness, and severe complications like kidney damage and heart problems. A doctor can recommend a safe dosage based on your blood tests and health profile. The key message: empowerment through knowledge. Vitamin D3 is a cornerstone of health. It regulates bone integrity, immune function, and mental well-being. A deficiency can silently undermine these systems and reduce quality of life. By understanding its roles, recognizing the signs, and taking practical steps to maintain optimal levels, you move toward preventative health. Small, consistent actions yield long-lasting benefits for resilience and vitality. In summary, pay attention to your body's signals. Prioritize sensible sun exposure and a nutrient-dense diet. Consider supplementation if needed, especially in long winters. If concerned or symptomatic, talk with your doctor. A simple blood test can provide definitive answers and guide a personalized strategy. Taking charge of your vitamin D status is a simple yet powerful investment in long-term health.